Now we're turning our focus to the gastrocnemius, or the main muscle that runs down the back of the calf. We're going to ask our patient to stand at a comfortable distance, at arm lengths approximately away from the wall, to lean forward and take your weight onto your hands and bring the leg to be stretched out behind you. We're going to then lean into the wall, which causes the knee to move in the direction of the wall, creating a nice stretching sensation in the muscle on the back of the calf. Things to look out for here is trying to keep your feet as straightforward as you can and not allowing the arch of your foot to fall down excessively. Again, holding that for a nice 30-second period, and as you come out of it, just ease back out in the other direction. So we're now going to move on to stretching the iliotibial band in a position with the knee extended. We're going to ask our patient to cross their legs over with the leg at the back being the leg to be stretched, so we're going to step the front leg across. We're aiming for about approximately a foot between your legs actually, so if we can try and move that just a little bit further. Taking your weight onto the wall, and then we're going to lower the hips in towards the wall there. The important things to look at here are trying to make sure that you keep your body straight, so you're not flexing forward or extending backwards. Again, we're looking to feel that sensation of tightness around the outside of the hip and just into the outer thigh. Holding this position for 30 seconds once again. And then easing out of it. Now we're going to perform going to demonstrate a hamstring stretch. That's the big muscle which runs down the back of the thigh. And we're going to ask our client here to put the foot up on top of a stable surface, which isn't going to move. We're looking to have both feet pointing straight forward, to try and maintain that. We're going to ask to just make sure that we're keeping the back nice and straight, and as you go forward to apply the stretch, not to bend your back, to try and keep the back nice and straight, so almost what you're doing is just rolling the hips backwards and allowing the hip to drift out, therefore feeling a nice tight sensation down the back of the thigh, and often you can feel into the calf as well. Again, looking for a 30 seconds hold, and as you come out of it, just nice and easy, relaxed as you come back out. The thing to watch out for here is bending the back, which makes it look like you get much further into the stretch, but in actual fact you're not doing anything more to the hamstrings. The next area that we're going to turn our attention to is the hip flexor. That's the muscle which runs across the front of the thigh, and we're going to start by asking our patient to kneel down. The leg that's going to be stretched is the nail that comes down onto the cushion, and that's placed there purely for comfort. We're then going to ask for the hand on the side of the leg being stretched to be raised up above the head. We're just going to engage the bottom muscles a little bit, which just slightly tilts the pelvis back, and then we're going to transfer our weight just slightly forward onto the right leg, which then creates a nice stretching sensation down the front of the thigh. And once again, we're going to hold this position for 30 seconds. You can use an external support for balance if you're struggling to hold that position, and then as you come out of it, just nice and relaxed on the way out. We're now going to go through a series of stretching exercises for the legs. Stretching exercises are generally better performed when you have warmed up a little bit the muscles, and 5 to 10 minutes of gentle cardiovascular exercise would be sufficient to do that. The first muscle that we're going to demonstrate is the quadriceps muscle, which is the muscle which runs down the front of the thigh, and we are going to do it in a lying down position. I'm going to ask our patient here, if we can, to extend the left arm. We're going to bend the right leg up to the back, and we're going to bring this right arm up, apply a gentle stretching force coming down with the heel up towards the bottom there, and what we're looking to feel is a nice tight sensation up the front of the thigh. Generally stretches should be held for 30 seconds. We're not looking to elicit any pain during the stretch. As I say, it's a nice comfortable stretching sensation we're looking for. The form of your body is extremely important here. The left hand helps to add to that, but what we want to try and be aware of is that we're not tilting the pelvis too far forward, and nice long 30-second hold, and as you go to relax, just nice and gentle as you come out of it. If you do need to intensify this stretch at all, putting something comfortable underneath the knee will bring the hip just slightly into extension. We'll just have a little quick demonstration of that. So that, yeah, just pops in, and then I literally once again would apply a very similar stretching. But we would, that would just be a way of intensifying the stretch because you've now brought the hip into an extended position. Lovely. So we can come out of that now, and I'm going to ask if we can bring you round onto your side now, if that's okay. Yeah. So, yeah, nice and comfortable round the side. We're actually going to try and we're going to try and keep both legs nice and straight. Yeah, so just running straight down through your knees, elbow supporting you. This stretch here we're going to be doing it for is an ITB stretch. Now, your ITB is not technically a muscle, it's a band of connective tissue, and so it doesn't contain the same stretch receptors as a muscle would, and therefore you're not likely to feel the stretching sensation over the area that we would associate the structure being. The tight sensation that you will feel is more over the outside of the hip and into the outer thigh. So for this one with a bent knee, we are going to ask our patient here to hold the back of the front of the foot and bring the knee back into extension. Then we're going to take this foot forward, and we're going to ask this heel to come up onto the outer aspect of the knee, and we're going to ask them to apply force down towards the bed. Again, we're looking to try and restrict too much movement happening around about the pelvis so that we can get this nice stretch over the outside of the hip. So this foot here, applying that force towards the bed and feeling a nice stretching sensation over the outside of the thigh. Once again, holding for 30 seconds. And as you come out of it, just nice and easy, bringing your foot out, letting go of the knee, and then coming out of that position.